You know, artificial intelligence is totally changing the game in medicine. It's promising this incredible future where we can diagnose diseases way earlier and get treatments that are tailored just for us. But as this super powerful tech gets its hands on our most sensitive health data, it's also making us face some really tough ethical questions. So, how do we even begin to navigate this new frontier? Let's get into it.
And this right here, this is really the heart of the whole thing. We've got this amazing technology that could literally predict our future health. But with that power comes a massive challenge, making sure it's fair for everyone without any prejudice. That's the core problem we're going to unpack.
Okay, so before we dive into all the challenges, it's super important to understand why everyone's so excited in the first place. AI isn't just some small tweak to the system, it's a whole new frontier for modern medicine.
And look, these aren't just some far-off, futuristic ideas. We're talking about very real benefits. We're talking about AI systems that can spot patterns in a scan that a human radiologist might miss, catching cancer earlier. They can design treatments based on your specific DNA. They can help cut down on deadly medical mistakes and just make hospitals run so much smoother. It's a huge deal.
Right, but here's the catch. To make all that magic happen, AI needs fuel, and that fuel is data, our data. And this is where the story takes a turn, because we have to talk about the hidden dangers that come with using our most personal information to power these systems. I mean, just think about it for a second. Every single lab result, every note your doctor has ever written, every scan you've ever had, it all creates this digital story of you. And this story is incredibly personal. It's not just about your body, but your genetics, your mental state, your family. And that's exactly why the ethical stakes are just so incredibly high.
And that brings us to one of the biggest, scariest problems, algorithmic bias. See, an AI is only as smart as the data you feed it. And if that data already reflects all the existing inequalities in our healthcare system, which it usually does, then the AI doesn't just learn those biases, it can actually make them worse.
Okay, this is a perfect example of how this goes wrong in the real world. There was a real algorithm used by hospitals that was supposed to flag high-risk patients for extra care, but it kept ranking Black patients as healthier than they actually were. Why? Because the AI used healthcare spending as a stand-in for sickness, and historically, less money is spent on Black patients. So you see this direct line from biased data to a seriously harmful outcome.
And yeah, let's be crystal clear about what's at stake here. This isn't just some abstract data problem. It's not just a glitch in the code. When an AI gets it wrong, when it misjudges someone's risk for something like a heart attack, that mistake could literally be fatal. Getting this right is a matter of life and death.
So, we've talked about data and code, but what does this actually look like in the doctor's office? How does this technology affect that really fundamental relationship between a patient and their doctor?
Well, a huge piece of the puzzle, and honestly the kind of unsettling part, is this idea of the black box algorithm. A lot of these AIs are so complicated that we don't really know how they think. An answer comes out, but the why, the reasoning, is locked inside a system that even the people who built it can't fully explain.
Just imagine hearing that from your doctor. You're being told to undergo a treatment, but the expert you trust can't actually tell you why the computer recommended it. That puts both the patient and the doctor in this impossible situation. It just completely erodes trust and the whole idea of informed consent.
So what's a doctor supposed to do? This is the tightrope they have to walk every single day. If their gut and years of experience tell them one thing, but the all-knowing algorithm says something else, who do they listen to? They're worried about getting sued if they go against the AI, but they're also worried that relying on it too much will make their own skills get rusty.
And it doesn't stop with just diagnosing what's wrong today. Oh no, AI is now trying to predict your future, calculating your risk of getting diseases years from now. And, as you can probably guess, this opens up a whole new ethical minefield around privacy.
And the risks that come with that? They are very, very real. Could your insurance company use a prediction to jack up your rates or deny you coverage? Could a future boss see your high risk and decide not to hire you? And what about just the psychological weight of being told you might get a terrible disease, especially if the AI turns out to be wrong?
Okay, so after all of that, how on earth do we fix this? How do we move forward without messing things up? Well, the answer is we have to forge a kind of moral compass, a solid ethical framework to guide us through this.
A lot of smart people have boiled it down to these 5 key principles. We need transparency so we can actually understand how these things are making decisions. We need accountability so someone's responsible when it goes wrong. Fairness to make sure the benefits are for everybody. Privacy protection, which is a no-brainer. And maybe most important of all, human oversight.
A real doctor always needs to have the final say. And look, this isn't something that tech folks can just figure out on their own. Nope. This has to be a team effort. We need to bring everyone to the table. Patients, ethicists, lawmakers. We got to update our laws for the AI age, set up ethics boards in hospitals to check this stuff, and constantly audit these systems to catch bias before it does any real damage.
When you get right down to it, figuring all this out isn't on any one person or group. It's a responsibility we all share, from the coder to the clinician to the patient. So what this all comes down to is this. AI has the potential to be one of the greatest things to ever happen to medicine, but we'll only get there if we stay vigilant. We have to be proactive, make smart rules, and never ever forget that the patient has to come first. Always.
Which, of course, leaves us with the biggest question of all. As we build this new future, we have to keep asking ourselves, are we building systems that serve people's health, or are we just building systems that serve data? Getting that right is the challenge that's going to define medicine for all of us.